Welcome to the Student Training for Community Pharmacy Enhanced Services Network's introduction. This is part of an APPE curriculum developed by the University of Arkansas for Medical Sciences and Idaho State University. From this presentation, you will be able to summarize the evolution of payment changes in the healthcare system and how this has contributed to the formation of Community Pharmacy Enhanced Services Networks, abbreviated CPESN, and define and describe CPESN and the services they provide to benefit patient care. Due to the rapid development of new drugs, pharmacy had to find a way to contain costs. This increase led to the creation of the pharmacy benefit and pharmacy benefit managers, or PBMs, and providers moved to a fee-for-service model, which created separation between pharmacies and the healthcare team. These models actually raised costs and did not incentivize positive patient outcomes. Due to this trend, healthcare in the U.S. is moving away from fee-for-service towards a value-based healthcare system that rewards quality and pays for performance, with programs such as 30-day readmission penalties and shared savings programs. CPESN is a group of pharmacies similarly focused on patient outcomes. These pharmacies provide services above and beyond the pharmacy benefit. They provide strong relationships with members of the patient's local care team, enhance patient-centered services that improve the health of complex patients, and provide pharmacy-wide focus on patient outcomes. The definition of CPESN is a network of community pharmacies that coordinates patient care with broader care teams to give medication optimization activities and enhance services for high-risk patients. High-risk patients are those with several chronic or complex diseases and take many chronic medications, presenting opportunities for medication optimization and closing gaps in care. These are the patients who benefit most from CPESN services. Pharmacists and pharmacy employees are in an excellent position to assist patients with their health on a day-to-day basis. Patients visit their primary care physician on average 3.5 times a year, but go to their pharmacy 35 times a year. Patients get to know and trust their pharmacist and appreciate the opportunities for easy access to health care. CPESN USA is an organization that provides a national network of community pharmacists who are working together to grow the profession and improve health care. It is a network of networks, a clinically integrated network of community pharmacies across America. It is a shared savings entity for local CPESN networks to have a national presence, an economy of scale for clinically integrated activities such as best practices and shared quality reporting. CPESN USA is a narrow but open network. Any pharmacy can join if they meet the minimum service requirements and agree to a monthly participation fee. Joining CPESN USA requires the pharmacy to also join a local network. CPESN participating pharmacies agree to share data, best practices, and a financial commitment to the network. CPESN USA is governed by a board of managers representing local CPESN networks. Each local network is required to appoint a lead network facilitator who manages daily operations of the local CPESN network and is a general point of contact. An account manager who is responsible for managing requests by community pharmacists enrolled in the local CPESN and management of contracts and agreements with CPESN USA. And a lead luminary, who is the primary representative of the local CPESN and serves as the voice for participating CPESN pharmacies. The local CPESN may appoint additional luminaries who provide vision and leadership and are local spokespersons representing the network. Many services can be grouped as CPESN enhanced services. Minimum service requirements for all CPESN pharmacies include comprehensive medication reviews, This is the most in-depth part of medication therapy management, which consists of providing a systematic assessment of medications to identify medication-related problems, prioritize those problems, and create a patient-specific plan to resolve them, working with the extended healthcare team. Clinical medication synchronization is a service that is highly beneficial for chronic care patients in which their medications are scheduled to be filled at the same time each month. Not only does this service increase adherence, but also allows the pharmacist to clinically review the safety and effectiveness of their medications to ensure patients are achieving their therapeutic goals. Immunizations are a vital part of preventative and public health. CPESN pharmacies are focused on screening patients for ACIP recommended immunizations, educating patients about needed immunizations, and providing a referring to other healthcare providers. Medication reconciliation includes reviewing all of a patient's medications and providing them with an accurate list of their drugs. Personal medication record. Pharmacists can put together a record for their patients of the current medications they are taking, how and when to take them. This is another service helpful to both patients and other healthcare providers. Face-to-face access. Each CPESN pharmacy must provide each patient receiving a dispensed medication ready access to unscheduled face-to-face meetings with the pharmacist employed by the CPESN pharmacy during operational hours. Additional optional services vary by pharmacy. Some examples of common additional services include prescription delivery, disease state education, specialized packaging, adherence monitoring and education, point-of-care testing, and pharmacogenomics. All CPESN pharmacies document the services they provide with new technology via the Pharmacist eCare Plan. The Pharmacist eCare Plans are a new way of documenting the interventions pharmacists have with their patients. This information will soon be available for other healthcare providers to reference while treating the patient. It is also a great record of the services pharmacists provide, a step towards payment for services and recognition of the profession's value. Documentation can include goals, health concerns, active medication lists, drug therapy issues, side effects, drug reactions, allergies, laboratory results, payer information, and billing for services. Some obvious benefits for sharing this information with other healthcare providers includes care planning and follow-up, interprofessional care and collaboration, and a new source for revenue. CPESN pharmacies provide several positive patient outcomes. More patients will follow up with their primary care providers. More patients use their medications and use them correctly, resulting in less hospital admissions and emergency department visits. Additional outcomes data from CPESN pharmacy efforts are growing. Some early evidence includes increasing medication adherence, decreasing blood pressure, and decreasing the total cost of care. You have now completed the introduction to Community Pharmacy Enhanced Services Networks.